This Health Ranger Report Pandemic Podcast is brought to you by NaturalNews.com for uncensored reporting and HealthRangerStore.com for lab-tested preparedness supplies such as storable food, full-face medical masks, biostructured silver first aid gel, and iodine, only while supplies last. We've got Dr. Birx now, part of the White House group on the coronavirus, saying that the best case scenario is 100,000 to 200,000 deaths in the United States from the coronavirus. That's the best case scenario. Now, I recently put out an article that estimated 45,000 to 90,000 deaths based on our current trajectory by the end of July. So I think Dr. Birx and Dr. Fauci are a little bit too high with their numbers. Yeah, maybe they are high, but their numbers are too high. And I think it's going to be a little bit lower than that. But I've also offered a way to make it much lower. We have solutions for this now that I've discussed in other podcasts on pandemic.news that cover zinc and hydroxychloroquine, as well as masks and the testing of asymptomatic carriers. We have solutions for how to beat this and keep the deaths, frankly, under 50,000 Americans if we put these into play right now. So this is Mike Adams here, pandemic.news, and this is being recorded on March 30th, Monday. The good news in all of this is that the number of projected deaths, even by Dr. Birx, is much lower than where it would have gone had we done nothing. Remember that President Trump was very slow to acknowledge that this was real. For most of February, he was saying it's no big deal and it's just going to go away. That was nonsense. I was warning people that we were headed for 2.16 million deaths by July 4th in the United States. And that's exactly where we would have gone. Actually, my numbers turned out to be quite low. We probably would have been at 3 to 4 million deaths by July. But thankfully, some things changed. Trump kind of woke up. He started blocking flights. He took more aggressive action. He started listening to Dr. Fauci a little bit more. And we have had a lot of mitigation effects at the state level and the local level all across America, so that now my current projections put us at 45,000 to 90,000 deaths by July 4th. That means, or by the end of July, excuse me. That means that we have already, as a nation, we have prevented probably something like 2.1 million deaths by taking these steps, these mitigation efforts, or what are called NPIs, or non-pharmaceutical interventions. Social distancing, basically locking things down. But the cost of locking things down, of course, is the economic consequence, which is quite severe. The number of restaurants going out of business and, commercial real estate is just cratering. It's just collapsing. And so a lot of the economy is really suffering in a dire way because of these lockdowns. So how do we end the lockdowns? And that gets to the things that I've talked about in other podcasts. Again, zinc and masks and testing of more people and hydroxychloroquine. Basically, nutrition is the answer here. And yet we live in a society that no one's allowed to talk about nutrition. So we get these very dire numbers from the CDC and the NIH and even the White House. And the question is, why isn't Trump telling America to take zinc and vitamin D? And vitamin C. I mean, it's so simple and it's very low cost. He ordered GM to start making masks. He could order some other company in America to start making zinc supplements. You could hand out zinc for free across the country. You could just have zinc available at every post office or with food stamps or something, every grocery store. You get a free bottle of zinc with every purchase over $25 or something. You could flood the country with zinc or vitamin D, both of which are probably extremely useful against any kind of respiratory-based infectious disease, including viral diseases. So why isn't that happening? And the frustrating answer is that Trump and the White House are ruled by Big Pharma. And it seems that Trump wants to protect the stock market so much. He wants to protect the pharmaceutical corporations and their earnings and their stock prices. So he's allowing Big Pharma to dictate the narratives and the information. I mean, Dr. Fauci is all pro Big Pharma. He's all tied into Big Pharma and the vaccine industry. And Dr. Birx, probably the same. I mean, these people are all pharma whores or pharma prostitutes, you might say. They don't have the best interests of America in mind. They have the financial interests of the drug companies in mind. So they don't want to tell America, hey, take some zinc, because zinc is dirt cheap. Zinc supplements can be made for, pennies per capsule. And you could treat all of America for just pennies per day per person. We're talking about a fraction of even the bailouts that have happened already. They've spent trillions of dollars on bailouts. Well, why don't you spend, I don't know, $100 million on zinc supplements? You could save the country a fortune. The investment in the population of even just making zinc and giving it away for free, you would have enormous returns in terms of healthcare savings across the entire country. In fact, I've pointed this out before in previous podcasts that if the government did this sort of socialized nutrition thing and just made supplements and gave them away for free, just free vitamin C for everybody, free vitamin D for everybody, free zinc for everybody, free omega-3 oils for everybody, whatever, the government would save so much money on Medicare and Medicaid and Obamacare and all these things that it would actually save the government a fortune to do that, along with some messaging, of course, that encourages people to take these supplements, because you do have to encourage people and explain why you take the supplements. So it's the best investment the government could make would be to just hand out nutrition to everybody. But it's not going to happen because the government is run by Big Pharma, and Big Pharma doesn't want nutrition. Big Pharma doesn't want anything to take place that would reduce the number of patients that the pharmaceutical giants are expecting to have, future waves of revenues and sales for sick people who are really the backbone of the pharmaceutical industry. They have to keep people sick. That's why Big Pharma is celebrating this pandemic. They love the idea of 100 million Americans getting infected and getting sick and having complications and secondary infections and all these things. So the drug companies are ordering the media to attack colloidal silver or zinc or any number of other natural supplements, vitamin D, whatever. They're attacking all those things because those things would deprive the pharmaceutical giants of their revenues by keeping people healthy and stopping the disease, stopping the pandemic. So we've got to exorcise Big Pharma from our culture and our government and our media. Big Pharma is a death industry. Big Pharma is the enemy of humanity. Big Pharma wants you to stay sick and spread it to other people so they get sick, so that Big Pharma gets the maximum payout when it's all said and done. Big Pharma has no interest in stopping any sickness, whether it's diabetes or heart disease or Alzheimer's. They love these diseases, most of which are caused by nutritional deficiencies, which could be solved by government if government were willing to engage in, the free distribution, manufacturing of all of these nutritional supplements that could literally be given away for free. I would even say that Big Pharma is killing more people than the coronavirus. In the United States, it's estimated that Big Pharma kills anywhere from 100,000 to over 200,000 Americans a year. I think one of the more cited studies says it's 106,000 Americans a year killed by Big Pharma. Well, now you can add all the coronavirus numbers to that, because really the coronavirus deaths are Big Pharma deaths. And most of the cancer deaths, by the way, are Big Pharma chemotherapy deaths. So if you say cancer is killing, I don't know, what are the numbers, 400,000 Americans a year, something like that, 300,000? Most of those are Big Pharma deaths. So if you add up all the deaths from the drug-induced heart disease, the drug-induced cancer, the Alzheimer's, and now this coronavirus and so on, you might really be at something much closer to 1 million Americans a year killed by Big Pharma. That's how dangerous Big Pharma really is. Maybe it's not quite 1 million, but it's a very large number. And those are real deaths because of the pharmaceutical worship in our country and how doctors are bribed by Big Pharma and brainwashed into writing prescriptions instead of recommending nutrition. Nutrition is the answer. You want to have a healthy nation, you have to teach people about nutrition. But if you want to have a high-profit pharmaceutical industry, well, then you suppress nutrition and you tell people that only prescription medications can treat disease, which is a lie. But that's the path that our country has chosen, and our media and our universities, our medical system, and sadly, the Trump administration as well. So that's where we are right now. It didn't have to be this way, but that's where we are. Share this message everywhere. This is Mike Adams, the Health Ranger for pandemic.news and naturalnews.com. Spread the word, encourage people to get healthy, and embrace nutrition. That's the real answer to all these issues that we've talked about. Thank you for listening. When it comes to prepping, you not only need good products that can help keep you alive, awake, aware, and nourished during difficult times, you also need products you can trust. At the Health Ranger store, we do extensive laboratory testing using an in-house lab that's ISO accredited. It's inspected, it's audited. It's a 2-year process to even get that accreditation. We use multiple mass spec instruments, state-of-the-art science. I'm a published science author as well and a patent holder on several technologies, some of which we use variations of in our lab. The purpose of this lab is to help you make sure you get clean foods, superfoods, storable foods for emergency preparedness and survival use. We have a certified organic lab-tested, what's called Ranger Bucket collection of storable foods with some survival gear in the buckets to help you even boil water and cook those foods and so on. It's a fantastic product. We can barely keep it in stock even during normal times. In a crisis, we'll be wiped out of this product because it actually takes us a lot of time to make those products. But if they're in stock, you can get them now at healthrangerstore.com/prepwithmike. In fact, go to that URL, healthrangerstore.com/prepwithmike, and you'll see some of our survival and preparedness supplies, including iodine, colloidal silver products and gel first aid products, storable foods, superfoods, medicinal herbs for first aid, and much more. We have a lot of products for you to help you be self-reliant, to be safe, to survive difficult circumstances, natural disasters, and all kinds of things. If you want to get prepared, do it with us at the Health Ranger store so that you know you're getting safe, clean, laboratory-verified preparedness foods, supplements, and other related products. Again, the URL is healthrangerstore.com/prepwithmike. All one word, no spaces. Prep with Mike. I'm Mike Adams. Thank you for your support. Thank you for watching. If you want to support our mission, visit us at healthrangerstore.com for the world's largest selection of lab-verified superfood and nutritional products for healthy living. It's at healthrangerstore.com.